I'm Bob Challoner, the President and CEO of Southampton Hospital, here with another edition of Focus on Southampton Hospital, your monthly program about the goings-on at your community hospital. We have a special program today, in addition to the fact that I'm outdoors here in front of Parish Hall with a lawnmower in the background. A program in honor of Breast Cancer Month. October is Breast Cancer Month, and we'll be interviewing a number of very important people with our breast program, the Ellen Hermanson Breast Cancer Center. The Ellen Hermanson Breast Cancer Center has been in existence for about 5 years, which started with support from many people in our community, and most particularly the Ellen Hermanson Foundation, and we'll be hearing from the president of that foundation in a little bit. But first, I'd like to turn it over to the medical director, Dr. Edna Kapenhas, who's been with us for about 5 years, a board-certified and trained breast surgeon who's just brought so much to our community and the breast center. Take it away, Dr. Kapenhas.
I'm Dr. Edna Kapenhas. I'm a breast surgeon, and I'm the medical director of Ellen Hermanson Breast Center at Southampton Hospital. October is Breast Cancer Awareness Month, and it's important to know that early detection saves lives. I'm here today to talk about some of the services that are available at Ellen Hermanson Breast Center. From the time you enter our breast center, and you get your mammogram. The mammogram is read by our board-certified radiologists. You'll be notified of the results. If there is any abnormality in the results or you need additional views, you'll be contacted to be scheduled for any further studies if needed. Again, if needed after that, an appointment will be made for you to see a breast surgeon to see me in the breast center. I will review the results with you after a complete clinical breast examination and come up with a treatment plan that's tailored for you. The current recommendation, according to American Cancer Society for screening, is yearly mammography starting at age 40. Although there is a lot of controversial discussions that in the media, some groups saying that maybe it should be done every other year and maybe it should be done for women 50 and older. I do still recommend yearly mammography starting at age 40. The other screening tools that can be used that is actually complementary to mammography is a sonogram. In patients who have dense breast tissue, it's in fact useful to do a sonogram, as the dense breast tissue makes it harder to see things on the mammography. In other subset of patients, an MRI may be useful in patients who are at high risk for breast cancer. If their lifetime risk of developing breast cancer is 20% or greater, again, current recommendation is to get an annual MRI in addition to their yearly mammogram. Other screening, also women who are 40 and older should also get a clinical breast exam, annual clinical breast exam by a clinician. That's any clinician that's trained in doing clinical breast examinations. Although the current recommendation by American Cancer Society is that they no longer recommend routine breast self-examination, and they actually say that women should still discuss it with their physicians. What's the benefits or the advantages and the disadvantages of doing a self-breast exam in their case. I still recommend to my patients to continue doing self-breast exam, as I have many patients who actually find their own cancer, or sometimes they're benign tumors. However, I think it's still important to do the breast self-examination every month. Some of the risk factors for breast cancer are if someone, of course, we're all women, so all women are at high risk for breast cancer, and that's something we cannot change. age. As we get older, we're at higher risk for developing breast cancer. The age that the woman gets her first period, if it's younger than 12, or the age that the woman goes into menopause, which is if it's later than age 55, these are associated with increased risk of breast cancer. Number of pregnancies and also having the first live child, full-term pregnancy, before age 30, that's actually associated with decreased risk of breast cancer. Obesity is associated with increased risk of breast cancer. There's reported to be at least 7% of increased risk of breast cancer for every alcoholic drink per day. Having a family history of breast cancer or ovarian cancer also is associated with increased risk. However, it's important to mention that most women who develop breast cancer do not have a family history. And most women who have a first-degree family history, one or more, actually will never develop breast cancer in their lifetime. Family history of breast cancer and ovarian cancer, which actually should raise a flag perhaps for considering genetic testing to see if the patient has a gene mutation, that's namely the BRCA1 and 2. These are the two genes that we know are culprits in increasing the risk of breast and ovarian cancer. There are certain things that we look for to send the patient for genetic testing without going into much details. If the patient has family history, mostly first-degree relatives, or it can also be second-degree relatives, especially if they were diagnosed with breast cancer or ovarian cancer. In breast cancer, if they were diagnosed at premenopausal age, or if the patient was diagnosed with breast cancer herself at premenopausal age, that should also raise some question whether the patient should be considered for genetic testing. Dietary factors. Recent studies actually show that there is really no association between the high content of animal fat and increased risk of breast cancer. However, the timing that the patient actually exposed to the fat content matters. So if adolescent girls they have a very high fat diet, that can be associated with increased risk of breast cancer. Because the breast tissue is not developed yet, and it's probably getting more stimulated by the hormones, and we know fat is a good source of storage for hormones. Smoking. Recent studies again show that it may be associated with increased risk of breast cancer. So the most important message from today is that early detection and yearly mammography save lives. But you have to take the first step. You have to enter our breast center. You have to have that first mammogram or your annual mammogram. And if there is something wrong, it's better to be picked up early than later, because early detection saves lives.
Well, thank you very much, Dr. Kapenhas. Again, I can't thank you enough for the great work that you are doing, and how lucky we are to have you working with us in our communities out here on the East End. Now I'd like to turn it over to another very, very important person in our struggle to care for people suffering with breast cancer, and that's Julie Ratner. Julie Ratner is the president of the Ellen Hermanson Foundation, one of the longest foundations devoted to the care of patients' diagnosis and treatment of people with breast cancer. But before I turn it over to Julie, I'd also like to thank a couple of other organizations. The Coalition for Women's Cancers here at Southampton, a group of women who've come together and really organized to raise money to provide support for women suffering from all the various forms of cancer. I'd also like to thank our friends at Lucia's Angels, who funded a very, very important project here at the hospital, Lucia's Room. a hospice room, people at the end of life, and I've heard so many wonderful comments from family members who've been able to take advantage of this room, stay with their loved ones, and all of the amenities that are provided there would not have been provided without the people at Lucia's Angels. Now I'd like to turn it over to Julie, who will tell us about the good work of the Ellen Hermanson Foundation and all they've done to support the breast center here at Southampton Hospital.
I'm Julie Ratner, founder of Ellen's Run and the Ellen Hermanson Foundation. I wanted to continue the work that was so important to Ellen, and I wanted to do something to ensure that her daughter Leora, who was only 6 years old when Ellen died, would always remember her mother. When I started Ellen's Run, I had no idea that it would grow into the huge event it has grown into, or that we would end up accomplishing as much as we've accomplished in 18 years. When Ellen's Run started in 1996, I had no idea that it would become the huge event it's become, or that we would become such a vital part of the local community. Very early on, as early as our first run, we made a decision that we would keep the bulk of the money we raised, and now it's almost 100% of the money we raised in the Long Island community. We believe in keeping the money in the community where it's raised, and this has allowed us to be very effective. Over the years, we've made significant contributions to the Southampton Hospital, really ending in the building of the Ellen Hermanson Breast Center, which opened in 2009. I'm particularly proud of this because the breast center offers state-of-the-art quality care to women and men living on the East End, and I think it's incredibly important that in a part of the state that has a very high rate of diagnosis and mortality, women and men have access to quality care in their own community. In addition, we started a program or a project called Ellen's Well, and we provide free psychosocial support to breast cancer survivors and their families and other healing modalities, which again improves quality of life, improves mental outlook, and I hope contributes to a better sense of well-being. As you can see, we're here at Cor Maria, this incredibly beautiful, serene piece of property in the middle of Sag Harbor, and yet it's an oasis. And it's here where we have the Day of Hope and Renewal every year, and it's a gift really for breast cancer survivors to come here. The usual program of the day is it begins with a panel where the doctors present about latest developments in the war against breast cancer, and the women in the audience get to ask all their questions that they have either about themselves or about what's happening in the world of breast cancer, and the doctors will just so thoughtfully, sensitively, and intelligently and generously answer all their questions. In addition, there are breakout sessions where there are other modalities, whether it's nutrition, whether it's Reiki, body movement, journaling, all kinds of breakout sessions. It changes from year to year, a lovely lunch, and the day ends with a healing circle, and it's a very beautiful spiritual day. We just finished the 18th annual Ellen's Run, which took place on August 18th at Southampton Hospital, and the day before we had an incredible gala. We called it our Pink Apron Party. It was all women chefs. It was very exciting and thank goodness successful, because last year we undertook a special project with the hospital, which was to fund a minimum of 50% of a new piece of equipment called a tomosynthesis system, which in effect takes a three-dimensional picture of the breast. It is the latest technology. After reading about it, I believe it will be life-saving because of its ability to diagnose breast cancer early. Because of the way the technology works, and I'm not a scientist, I understand it a little bit. It works like a CT scan, taking lots of little slices of the breast. And to me, this means that any structure, anything that should not be in the breast will be presented, which means an earlier, more accurate reading from the radiologist. We're very excited to be able to donate this piece of equipment and certainly fund a minimum of 50%, hopefully more. And that's what we're working on right now. And we're delighted.
Okay, so this is the tomosynthesis machine. We're thrilled to have this. It's state-of-the-art. And, you know, once again, Julie Ratner, along with the Ellen's Run, came up with the money so that the hospital was able to purchase this for us and for, you know, all the women here on the East End. So I'd like to explain a little bit on how this works. It does a 2D imaging as well as a 3D image. Okay, with the 3D imaging, this tube above, which is the X-ray tube, will pan across the woman's breast, and it will take images at various levels of the breast tissue. And right after that, leaving the woman's breast in compression, it will switch into a 2D mode, and then taking just the standard 2D projection. So the woman is in the compression only once for each image, and both exams are done together. This offers the radiologist a great deal of information, a bit more than they used to be able to get, especially for women with the very dense or fibrocystic breast tissue. It helps to see through all those densities, and it helps to separate them. But this reduces the need for calling back women because of the information that the radiologist is obtaining between the 2D and the 3D combined together.
In closing, I really want to thank Southampton Hospital for being such an extraordinary partner. It's been a privilege, I think, for us to work with the hospital, to get to know so many wonderful people. I really think Southampton Hospital is an extraordinary local community hospital. I'm very proud to have my foundation affiliated with it, and I look forward to really years of working together as we work to make this a healthier environment for all of us.
Thank you, Julie, and a personal note of thanks also. It was 7 years ago almost when I had just joined the hospital and met you and met with your board, and the generosity that you displayed in helping us develop the breast center was just amazing and heartwarming, and frankly gave me a boost of confidence to get started here at Southampton. So thank you so much for the good work that you do, and the many thousands of people that the breast center is helping today. And I'd also like to give my thanks again to Dr. Kapenhas for showing us around the breast center and what a unique resource it really is in our community, providing diagnosis, treatment, and life-saving information for people dealing with breast cancer. And finally, I'd like to make a strong pitch for everyone to please schedule their regular mammograms and give us a call and schedule your mammogram today at the Ellen Hermanson Breast Center at Southampton Hospital at 631-726-8285. I'd like to thank all of you, and particularly our friends at CTV for the good work they do each month in producing this show, and all the folks out at LTV in East Hampton for producing and showing to our East Hampton communities. If you have any questions or concerns, any need navigating the health system here at the East End, please call my office at 631-726-8555. Thank you, and good health, everyone.